All right, hello everybody. Thanks for joining us today on Facebook Live. My name is John McFarland. I am the clinic manager for the CORA Ormond Beach location here in beautiful Ormond Beach. I'm joined today by one of our patients. Her name is Shelby. She's going to be my athlete, if you will, to help me demonstrate activities that a person can do, runners, athletes, active participants who want to improve hip strength and lower core strength with the least amount of equipment as possible. So we're going to go through that exercise program here for you now. At this point, just to let everybody know, Shelby has already gone through an active warm-up. She's already utilized the treadmill to warm up, doing a good walk-jog method that we've been working on, trying to improve her athletic ability and her athletic tolerance. She's also gone through an active warm-up with stretching and agility work, working on hamstrings, working on some timing, working on sequential stuff, things of that nature. For a whole different day, for a whole different education video, but for today we wanted to really work on and kind of show the bread and butter of what we're trying to work on to try to improve what she needs to work on to improve for her athletics and for athletic needs. This is a great topic for a lot of individuals for going through what's going on now with the pandemic, being inside, not having gone out, not having participated in practice, not participating in doing a lot of anything. Say if you've been going out and doing running and just doing stuff on your own, and say trying to do drills, probably haven't been going as hard as what you normally go. You haven't been going as intensely. So what I wanted to talk about today for runners, athletes, we want to talk about ways to improve your lower core strength. We want to improve some lower extremity strength. We want to improve, we're going to do some stuff on the table to work on some bridging and go through a full course there, okay? So without further ado, myself, I'm obviously wearing a face mask. We're continuing to follow the state of Florida recommendations for wearing face masks. Shelby's chosen not to wear a face mask. I'm saying that's totally okay. It's totally up her choice. But to say for myself, so I'm going to try to speak as clearly as I can to try to make sure everybody can hear me and so we can get this thing done right for everybody, okay? So the first thing we're going to do, we're going to have Shelby position herself over here on the wall. And we're going to start with the exercise that we've been working with her on is to work on a heel raise in a plank position here on the wall. So I'm going to lower the camera down to give us a better angle so that you can actually see what she's doing here in the lower half, okay? So what we're doing is that we've gotten her on the wall in a plank position. And right now we're just basically priming the action and we're getting her in a really good runner's forward position. So notice the angle that we have her at here, okay? What we're trying to do is we're trying to get rid of that vertical upright position that a lot of people like to try to run in and they end up kind of scuffing their feet when they're running. Here we want to work on driving, we want to work on digging into the ground. So in this situation here, we've gotten rid of we're involving the forward lean and we're getting rid of any kind of vertical body position. All right, good. Shelby can take a break there. So from the very beginning, we're incorporating push-off. From the very beginning, we're working on trying to drive from the balls of the feet. Even though not everyone's going to be a ball of foot runner, you're still going to be pushing off during that drive phase, okay? Now, the next thing we're going to work on, we're going to get a semi-stack body position. We're going to get on that plank position on the wall. We got our midsection engaged. Now, before we go any further, what I want Shelby to show us, one of the things that we look for in this position here is we look into the midsection right in here, okay? And what I want her to do is I want to show us bad posture. So Shelby, let that midsection fall towards the wall. There you go, right there. Okay, now we don't want to be in that position there. Now go ahead and use those abs, pull right there. Good. So once again, we're looking for a vertical position with the body, but we're looking for the vertical position from the heels to the shoulders in that forward angle position, not in upright up and down. And we want to make sure that the belly button is not coming to the wall first. If the belly button is coming in first, we're going to lose everything else we're trying to gain with our athletic potential and with our ability to move. Now let's work on our A position. So now in runner's terms, now we're going to be in an A position for running, okay? Go ahead and go and lift. Now, in that A position, you're going to notice that we're going to get knee drive, we're going to get knee lift, we're going to get toe lift. That's good. Go ahead and switch. Switch back and forth for me. Good. Give me a short pause at the top. Alternate. Yeah, make it easier on you. So we're working on an alternating position. We're going to do a brief pause at the top for the count of hold of 1 to 2 seconds. Knee drive is one part of it, but we also got to be lifting up them toes, okay? The reason we lift up toes is because we want to make sure that foot's ready to engage the ground, okay? If we lift the knees up and get good knee drive, but the foot's hanging in front of us, we're not doing everything we can be doing to run as fast as possible. For distance runners, a lot of times you'll get a modified program where they'll want you to run sprints, or they'll put some sprint running into your distance running to work on your speed. This is an exercise that will help you with that sprinting, because with that distance running, you're running more in an upright body position. So then all of a sudden you start trying to incorporate sprinting, you're still running in that upright posture, and you can't figure out why you can't increase that speed and get faster. So in this situation here, now I'm incorporating that lower abdominal, the lower core strength around where the belly button is, and I'm involving strengthening here in the hip flexors, okay? So we want to make sure that we get the hip flexors involved, we get the toes up involved, and we get that midsection involved. All right, now, take a break, Shelby. Sit down. We've incorporated heel raising, and now we've incorporated hip flexion, okay? So we're working on pushing off with the foot, preparation of the foot. Now let's bring it together into one exercise, okay? For me, whenever I'm working with athletes, when I'm working with patients or whomever it is to learn about running, this is the sequence that I use because it's the easiest way for the patients to understand how to get back to running. They've had a surgery, if they've had a delayed injury, if they've been sitting down for long periods of time, not at the normal activity level, kind of the way everybody's been dealing with the pandemic. These are exercises to help us get back on our feet, get back into our running positions, and get back in that better running gait, okay? Now, let's combine those two together, so let's get back into a wall point position. We got a good angle, once again, good core involvement. Now, we're gonna do the heel raise first, good core, good calf engagement. Now, give me that A position, boom. So that position right there, okay? So we're gonna heel raise first, A position second, then relax everything down. Notice Sheldon is exchanging sides. You can switch sides as you go, or you can go one side at a time. For early on, I like to go one side at a time, let the patient or athlete understand what you're asking from them. Advancement, have them alternate. Even more advancement, they can get into a chopping pattern, like a 1, 2, 3, where they finish, come back down, pick up one side, 1, 2, 3. They hold and get in that pause position. For right now, I don't want to get that advanced. I want to just introduce the concept. A lot of people don't know anything about this. They've never utilized this as an exercise technique for themselves. So I want to get ourselves in a position, engaging the core, engaging the calf and the Achilles tendon, a lot of those areas that we haven't been using any kind of a powerful maneuver. We want to get those muscles involved so we can be better, okay? From this position here, now we want to go ahead and take a break. Now we're going to head to the table, okay? We've already got a table set up for us. Shelby's going to head over to our table here. Now I want to work on getting into some bridge positions, okay? Make sure we got ourselves in a good position here. We're going to back up so we can see. Perfect. Great position, Shelby. All right, now, with the bridging, I want to make sure that everybody understands that what we're trying to do here with the bridge, everything is happening once again from the belly button down. Everything from here on up is completely relaxed, okay? What we're trying to accomplish, we're trying to get as much activation in this area as possible, trying to get as much strength, trying to get push off, trying to get drive, okay? So the first exercise we're going to do is this. We're going to keep those arms nice and flat, and we're going to go ahead and bridge up from the beginning. Good, just like that. Give me about 3 to 5 of those, Shelby. Good, just regular bridge. All kinds of changes and all kinds of ways you can make this more difficult. If I've got a patient who's doing this for the first time, I'm not trying to make it more difficult. I just want to get the person to understand the bridge. Now, Shelby, let's show them that technique that's a bad technique that we were doing from the very beginning when you and I first met. Okay, so let's lift up like you were just lifting up. Now show them when we lift up too much through the middle and we get to hyperextension. See how we start humping right in here? See how the pelvis starts pushing through her shirt? Now go and relax. We're using the back. We don't want to use the back when we run. We want to use our hips. We want to use our abs. We don't want to use the lumbar spine. We don't want to use those extensors. We want to use our driving muscles. Let's go and show them one more time, Michelle. Lifting up, getting a good level position. I tell people, you can relax. I try to tell patients, we want to have a nice ramp going from the knees to the shoulders, basically going in a nice straight line. I shouldn't have any hump in the middle. If they're not strong enough and they kind of hang down in the middle, that's totally fine. They don't have to be perfect. Just give me a good leg drive. Give me a good lift to show me you know how to do a good bridge. Then we can build from that. If you want to make this more complicated, put a band around the knees. They sell all kinds of different bands. You can check on Therapy Essentials here with CORA Physical Therapy. See if there's bands there where you can obtain and get those. There's all kinds of areas where you can get those, get different areas where you can add some resistance. Now, the next one we're going to work on. Let's work on that A position. Let's work on that hip flexor strengthening that we we're just working on back here in the plank position. The A position is going to go into another bridge that we can utilize. So let's go and do that now. So let's go and show them that hip flexion on one side. Good, and back down. Remember, as you raise it up, pick that toe up for me. Perfect, just like that. Notice as we raise up, we want to engage those dorsiflexors, right? We're just working on that right over there. And essentially what I'm doing here is I'm establishing a movement pattern. I'm getting those hips involved, pretty much right here where my hands are. I want to work on hip flexion on the one side because I'm going to get leg drive off the other side. But I got to establish in my brain, what's that movement going to be like? What's it going to feel like? There you go, switch to the other side, perfect. Same thing, good knee position, good toe position. We're not fast, we're not trying to we're crazy with it. We're not getting left and right, we're not getting out of sorts. Working on our timing, working on things working together. All right, perfect. Now, we go from that bent knee, hip flexion, toe position exercise to then establish a bridge pattern, to work on that power, work on that push-off phase, okay? So, Shelby, let's go ahead. We're going to lift from that first side where you're lifting on your left, and we're going to drive on that right side, right? Good. Come back down. Perfect. Now, we're going to work on her sequence. She's a little bit late, that one. Perfect. And back down. Work on that leg drive there it is. That was better right there. As that leg picks up, we drive with the other side. Much, much better. Now notice, instead of being in that plank position, instead of holding herself rigidly, now she's flexing on the one side, driving down on the other side. Now we're getting that same core work, but now we're isolating on the one side. You always hear patients and clients, they talk about all the time, my one side's always weaker, it's always more tired. My one leg never seems to come around, or my one leg gets tired when I'm running, and I just can't seem to keep it involved. This is where it comes in at. Okay? Now, let's take a minute to talk about repetitions, okay? If we're talking about running, if you're talking about sprints, if you're talking about distance running, 5Ks, whatever it is, think about how many times you engage the ground. You engage the ground for hundreds to thousands of steps at a time. So what we want to make sure of is that our repetitions and our numbers are mimicking what our expectations are. With bridging, for somebody who's a runner, doing 2 sets of 10 or 3 sets of 10 really isn't going to get the job done. We have to have those higher number of repetitions. 2 sets of 20, 2 sets of 25. Those glutes have to be able to be powerful, not only to move us, but they have to be able to move us over time. They got to show us that they can do it over and over and over. That's what running is about. That's what successful running is about. That's what the athletes are able to do that are so blessed. They can just keep that rhythm going and going and going. That's what we're trying to do here. All right, now, let's take a little bit of bonus time here, all right? Only piece of equipment we're using. So far, notice all we've used is a wall and we've used a table. You're not gonna have a table at your house. If you do, great, use it. If you don't have a table, don't worry about it. You can use a floor, preferably not a bed. Use your floor, use a picnic table. Pool table, you might make people mad, but you can get away with it. Floor or a table is best to use. Body's nice and flat. Walls are nice and hard. Good wall plank position where we can work from, right? Now, last bridge that we're going to talk about. I refer to these as a cook bridge, okay? Learned these through my FMS training, all right? Great cook, phenomenal teacher, phenomenal understanding of body movement. I use this as an upper level advanced exercise for patients to show me they understand and they can apply what they've learned for glute engagement, core engagement, abdominal engagement, all those fancy words that we have in therapy. For my runners who are out there, this is when you know when you've had a knee injury, when you've had a surgery, whatever it is that you've been dealing with, this is an exercise to help let you know man, I'm really going on to that next level. I'm not doing a basic bridge anymore, okay? So we're gonna take the ball, and then we're in position. So position right in your chest, underneath, right there. All right, now, she's gonna take her knee, and she's gonna hold the ball right here, just like so. Now, put this hand on top, put that hand on top, leave that ball, so you leave the ball there, there it is, perfect. Now, she's gonna stay engaged, right? She's gonna hold that knee right there. Push off, bend the other knee a little bit for me, bend the right knee, no, bend it to you, right there is perfect. Now, that right foot's gonna push down, lift our bottom up off the table. Bingo, right there. See how that ball comes out? So what that tells us is that when we're really in that drive phase on that right leg, that left hip flexor doesn't stay engaged. That core doesn't stay turned under. So that's what we want to do here. Really, really good exercise. Go ahead and try it a couple times, Shell. Keep that knee nice. There it is. That was better. See how hard that is to do? Very good. Give me a couple of those and try the other side. Once again, great exercise. For that size ball, basically it's about the size of a softball, but it's a lot softer. It smashes. You can use all kinds of different activities. You can take a tennis ball, wrap it in a rag, make it a little bit thicker so it's easier to hold on to. All kinds of different items we can use at home, okay? Show the different angle here. You're gonna get the reverse side in this. Once again, driving down on the left side, picking up on that right side, and notice the difference in now the bridge. Her bridge was a lot higher before, right? When we didn't have this core engagement going on. So really, really trying to get that glute isolation going on here. Once again, folks, thanks for joining us. We hope you guys have learned a little bit. Shelby and I have been working together. Shelby's been getting better and better as the weeks go by. We hope you guys have a great day. Please stay safe. Stay tuned for more information here from CORA in the future. Thanks again.